I've been very interested in sickle cell anemia. I actually had a very personal and up-close experience with it. My stepson actually died from the disease after he had a stroke as a young child.
Well, my original experience with sickle cell was my son's best friend growing up. He died at a very young age, at the age of 15, and my experience was to see the toll it took on a child.
I have had distant family members who suffered from sickle cell, one of which was a cousin who actually died of the disease.
It's a disease that people are born with, and it's mostly manifest due to some blockage in the blood vessel, and it leads to a tremendous level of pain during crisis.
Well, the catalyst for our entire program stemmed from an email from a concerned grandmother.
And she talked to us about the different experiences that her grandchild was having.
And we did a very subpar job of taking care of her pain. Her email also expressed how important we were as her community hospital, and she had high expectations that we would serve the population better.
And we determined at that time that it was absolutely mandatory that we have a laser focus on making the changes that are necessary to ensure that we can provide the appropriate care to this patient population.
I think many of our staff are aware of sickle cell disease, but I don't think they were exactly aware of how much sickle cell disease we see in the community around Hillandale. Knowledge is really a tool for improving the care that we're able to provide, and we did that in this situation.
It's very important that we had feedback from different care providers, so getting everybody who's involved in the management of the patient from the time they hit the door to the time they leave or get admitted is very important.
We took the information from Duke University that had been provided, and we tailored that to better meet the needs of our population here.
We provided training sessions for all staff and physicians, and I think it set the tone for everyone to be on the same page.
Managing sickle cell, we know time is of essence in terms of pain control. A crisis that's supposed to last for a couple of days could last for an entire week because the window of opportunity in terms of treating the patient has been missed.
The emergency department is going to be your first point of contact for a sickle cell patient experiencing a pain crisis.
When a sickle cell patient arrives to the ER, they immediately go to the triage desk and tell the triage nurse their signs and symptoms and that they're in a sickle cell crisis. At that point in time, the protocol has allowed us to have a streamlined process to get them back to an ER room.
And from there we do start a regimen of lab work and immediately medication. The difference now is that we really concentrate on listening to the patient and attending to their pain.
Oftentimes, sickle cell patients are undertreated because they have the stigma of being drug seeking. However, they can come to us and trust us, and I get satisfaction in knowing that we can effectively treat their pain.
There will be patients who need more care, but those patients are subsequently admitted into the hospital, transition into our inpatient protocol, which is also another aggressive pain regimen.
Before we adopted this protocol, the experiences, both my experience and the patient experiences was really challenging, and I am personally very glad that we adopted the protocol that we did.
We have seen tremendous improvement for sickle cell patients with pain management and the duration of time spent in our emergency department.
This initiative has been a true success story. I am so proud of this facility, and I'm so proud of our ability to make a difference in the people who live in this community. We have reduced the amount of time that these patients spend in the ED. We have reduced the amount of time that it takes to reduce their pain score.
And I knew that we had embraced the change tremendously. When I walked into a staff lounge and I heard the entire staff animated in discussion about how well one of our sickle cell patients was treated and the tremendous positive feedback that he was expressing about his care.
The level of engagement and teamwork that we have seen has been a key to the success of this project, and the outcomes have shown that.
It really makes me happy to be able to treat these patients and to really have them be satisfied with the care that they receive.
We've seen a lot of improvement in some of our patients' lives, ability to go to work, ability to spend more time with their family, and be a productive member of the community.
This has been a perfect example of how when we come together with a common goal, we can and will continue to meet the needs of our community.